Enchondroma, it is abnormality of chondroblast which skips and migrate to in the bone and creates a lesion. It is second most common benign cartilaginous tumor after osteochondroma. Happens in second to fifth decade. Composed of hyaline cartilage. Most common in hand and phalanges. Also in distal femur and proximal humerus. It is asymptomatic but may disrupt growth plate. The X-ray shows lytic lesion, popcorn calcification, chondroid matrix with defined thin cortices and bone expansion. Allowing fracture to heal might allow ossification. Treatment is curettage with burr or a chemical cauterization with phenol with packing with bone graft. Follow up with 2 years and the recurrence is about 10%. In Enchondroma, the location is important. It should be documented for histology. It should be differentiated from bone infarct by smoke-up chimney radiographic appearance related to intrinsic vascular compromise and asymptomatic and doesn't require treatment. Ollier disease is a non-hereditary congenital error. It has multiple enchondromas. It is a type of skeletal dysplasia with failure of normal enchondral ossification. Enchondromas occur throughout the metaphys and diaphysis of long bones. Involved bones are dysplastic and shortened and bowing. There is a 20 to 30% risk of chondrosarcoma. Myphosis syndrome is again a non-hereditary congenital error. Multiple enchondromas, hemangiomas, and lymphangiomas. Risk of sarcoma is up to 100%. Features that suggest chondrosarcoma translucency developing within calcification or a periosteal reaction. There is increased risk of vascular malignancy in such lesions.